These look like, no, I'll leave these here in case. Dollar store glasses, you can't really rely on them.
Are they a dollar?
Yes, well, no, they're $1.25. Everything went up, inflation.
That's terrible.
Senator, we're going to start with the pledge and then we'll. Senator Ennis is going to lead us in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Senate Commerce is now in session. We're starting with my favorite senator. Go ahead, Senator.
Okay, thank you. Thank you, Mr. Chairman. For the record, I'm Senator Cindy Rosenwald from Senate District 13 in Nashua, and I am pleased to introduce Senate Bill 200. This bill will help make it more convenient and less expensive for adults to receive certain vaccines. Specifically, it will authorize optometrists to administer influenza, COVID, and shingles vaccines only to adults. Optometrists have doctoral degrees and are well-versed in sterile technique and medication storage. And I should say that you've probably been getting a lot of email from the ophthalmologists raising some concerns about the ability of their colleagues in a related field to safely deliver these vaccinations. We've been authorizing for 15 years, we have allowed adults to receive many more kinds of vaccinations than this in pharmacies. In fact, I was the original sponsor of what is now RSA 318:16B, which authorizes not just pharmacists who also have doctoral degrees, but pharmacy technicians and pharmacy interns to administer a broad range of vaccinations to adults. We've been doing this for 15 years, and we have not had any complaints so far. I think people like getting the option of getting their annual flu shots where they routinely go. This bill offers a convenience to patients and would also save them money because it would avoid a separate trip to a doctor's office, which brings an additional copay and often a co-insurance or maybe spending down against a deductible. So I think it's easy to see why this bill makes sense, but there are a few optometrists here who would like to explain why they want to do this and why they think it makes sense. I'm happy to answer questions. Thank you.
Thank you, Senator. Boy, you remembered the numbers from years ago. You have a good memory.
I looked it up.
Oh, okay.
No, I remembered it, of course. I remembered it.
Thank you, Senator. Does anyone have any questions for the senator? Any questions? Seeing none, thank you very much for your testimony. Dr. Allison Loringer. Good morning, doctor. How you doing today? Couldn't be back. I got the flowers, got the candy. I'm covered.
Hampshire. Thank you. I attended the undergraduate at the University of New Hampshire and then the New England College of Optometry in Boston, graduating in 2010. I'm a diplomat of the American Board of Optometry and serve on the board of the New Hampshire Optometric Association. I currently live in Goffstown and practice full-time in Manchester at New Hampshire Eye Associates. Thank you for the opportunity to speak to you today in support of Senate Bill 200, a bill that seeks to accomplish two goals. First, authorize optometrists to administer vaccines, and secondly, amend the optometry statute to allow optometrists to prescribe medications for the treatment of the lacrimal gland. I'll start by addressing the lacrimal gland restriction first. Optometrists in the state of New Hampshire have been able to treat all anterior segments of the eye and adnexa with oral medications since 1993, with the exception of the lacrimal gland. The lacrimal gland is located in the upper outer corner of the eye socket and produces the water layer of the tear film. There is an uncommon but very serious inflammation that can occur in the lacrimal gland called dacryoadenitis. If the cause of the inflammation is infectious, this infection can spread to the surrounding tissues, causing orbital cellulitis, which can lead to blindness and death. Any delay in treatment, even while referring to an ophthalmologist, increases the risk of those complications. Optometrists have long been trained in the diagnosis and treatment of lacrimal gland infections by accredited colleges of optometry, and in fact have the authority to treat orbital cellulitis, but not one of the precursors, the dacryoadenitis. Removing this restriction removes the delay in treatment that can protect patients from potential sight and life-threatening conditions. I'm happy to take any questions on that first part of the bill after your anatomy lesson. Okay, thank you. Moving on to the second portion of the bill related to vaccines. As you probably guessed, this restriction came to light in early 2021 when there was an immediate need to expand the workforce of trained medical personnel to administer the COVID-19 vaccine. Doctors of optometry signed up to volunteer and were denied. Meanwhile, people with little or no medical training were allowed to take an online course and get to work. This list included medical assistants, LPNs, dental hygienists, and pharmacy technicians. In New Hampshire, if I have a high school diploma or GED, I can administer vaccines, but not if I have gone to 4 years of college and then obtained a doctorate in optometry, where I learned about the body and the eye. So, in this state, if I do not have the medical training that I have, I can administer vaccines. Along with all other medical professionals who vaccinate, we will be required to fulfill the proper training requirements for administration, safety, and adverse events, as the bill states. The need to expand the types of healthcare professionals with the authority to administer vaccines is not partisan. Both the previous presidential administration and the current administration have highlighted the need for states to expand their workforce that can provide vaccines. Our intentions are to have the ability to fill in the necessary gaps and to be of service to our communities. We are living in a world with more vaccines than ever, and there is no reason why we need to be the only medical professionals excluded from the effort. So I ask that you please support Senate Bill 200, and I thank you for your time and service. I'm happy to take any questions.
Thank you for your testimony. Do we have any? No, thank you very much for your testimony.
Thank you.
Appreciate it. Dr. Scott Huffer. Welcome, Dr. Huffer. How are you doing today?
I'm doing well. How are you?
Good.
Mr. Chairman. Good morning, Mr. Chairman. Good morning, Senators. Thank you for this opportunity this morning. My name is Scott Huffer, and I am an eye doctor and one-third owner of Focused Eye Care with offices in Nashua and Milford, New Hampshire. I am the immediate past president of the New Hampshire Optometric Association, fellow of the American Academy of Optometry, and a residency-trained doctor of optometry. Focused Eye Care, my office, currently employs 7 full-time doctors and another approximately 38 support staff. Last year, our providers provided eye care to over 12,000 people. Suffice to say, we provide eye care for a lot of people in our community. In my experience, it is common to see patients who have not seen their primary care doctor in many years. I also see patients daily who do not have a primary care physician due to providers retiring, relocating, or patients simply neglecting to select or find one. I frequently see patients who have not had flu vaccines, COVID vaccines, or shingles vaccines, despite it being in their best interest. The most notable is probably the shingles vaccination, as it can cause temporary or permanent vision loss when involving the eye. Ideally, patients should be receiving these vaccines, but public health data tells us that it's simply not happening. The shingles vaccination has been around for many years, is well tested. In adults 50 to 69 years old with healthy immune systems, this vaccine was 97% effective in preventing shingles. In adults 70 years and older, it was 91% effective. This is a vaccine success story, but only about 30% of adults who might benefit from this have received it. And 1 in 3 adults over the age of 50 will get this condition. And this is just one example of how adding another well-trained group of doctors into the mix of providers will help the state of New Hampshire improve health outcomes. Our patients come to see us as a matter of need so they can see to work and live better. We regularly educate them on smoking cessation, the importance of vaccines, and other important preventative measures. So it only makes sense that we can offer this if a patient is ready and willing to do so. Optometrists could be a critical component of increasing vaccination rates and decreasing disease burden across the state. Doctors of optometry are fully capable of performing vaccinations. Intravenous and intramuscular injections are part of the curriculum at every optometry school, and injection certification is an optional part of the National Board of Exam for optometrists. Optometrists are currently authorized to perform injections in 22 states. I'm sure the biggest question anyone would have would be what happens if a patient suffers a severe allergic reaction during vaccination. But emergency preparation is a critical process in all offices. Our offices have always maintained emergency medications, automated defibrillators in our offices. All of our providers must maintain cardiopulmonary resuscitation and emergency training as it is required for licensure. In our offices, we also provide in-house CPR training for all staff members, and we regularly close the office and meet to go over emergency preparation. Just like any doctor's office or pharmacy where vaccines are administered, we too rely on the emergency management system for otherwise more serious events. Luckily, this is very rare. Anaphylaxis rates for the COVID vaccination are about 11 per 1 million doses. For the flu vaccination, it's even more rare at 1.35 per 1 million doses. Recently in our office, we had an issue where a patient suffered a pretty significant seizure in our waiting room, and our staff handled the situation professionally, as expected, and as we are all trained. So, in summation, authorizing optometrists to provide vaccinations could safely increase vaccination rates and prevent significant disease across the population of New Hampshire. Thank you.
Any questions? I want to thank you, and thanks for reminding me to get my shingles vaccine. Keep meaning to do that. Thank you. Dr. Morse. Good morning, doctor. How are you doing today?
Good morning. Thank you for allowing me to speak. My name is Dr. Christy Morse. I'm actually a pediatric ophthalmologist. I've been practicing here in New Hampshire for 32 years. I started the pediatric ophthalmology program at Dartmouth Hitchcock Medical Center, which now is Dartmouth Health, where I worked for a decade prior to entering private practice here in Concord. I'm practicing here. Following college at Yale, I spent 4 years in medical school at the Medical University of South Carolina, 1 year practicing internal medicine, 3 years in ophthalmology residency, and 1 year in fellowship practicing pediatric ophthalmology. That's a total of 9 years of training following 4 years of college. I work collaboratively with many optometrists throughout the state. I refer patients to optometrists for certain vision care needs. I value my relationship with optometrists, and many I consider my personal friends. I'm here today to speak in opposition to the injection of medications in SB 200 for several reasons. I have props showing that there's no access issue in patients in New Hampshire to receive vaccination. In fact, 97.9% of the population of New Hampshire is within a half-hour drive to a Medicare-enrolled mass immunizer. If someone is sitting in an optometrist's office in New Hampshire, they are no further away than 15 miles to a mass immunizer. In fact, there are only 3 zip codes in New Hampshire that do not have a Medicare-enrolled mass immunizer within 5 miles. So I don't consider this an access issue at all. Secondly, there is no uniform, consistent training throughout all optometry schools to provide injection of medications. Third, in my over 30 years of practice, not once have I heard of an ophthalmologist who is legally allowed to perform vaccinations choosing to vaccinate their patients, or ever having a patient actively ask their ophthalmologist for a vaccine that is typically given in New Hampshire, either in a primary care office or in a pharmacy. Regarding the use of epinephrine, the bill does not exclude giving epinephrine intravenously. This is a big patient safety issue, as if an intramuscular dose is mistakenly given intravenously, patients will die. That's simply what will happen. And finally, setting up a safe vaccination site is no easy job. It's more than giving patients an appropriate injection. You have to review their vaccination history. The vaccine needs to be appropriately mixed with the specified diluent of the correct dose. And vaccines such as COVID-19 need to be stored in special refrigeration units down to minus 20 degrees. And there also needs to be a mechanism in place to report and record adverse events following a vaccine. And the list goes on and on about how difficult it is to set up a vaccination program. And finally, as a pediatric doctor, I'm not here because the legislation is asking to inject medication into any of my patients. In fact, the bill specifically excludes New Hampshire residents under age 18. I'm here simply because I believe that the safety of New Hampshire residents is of the utmost importance. And we have proven that there's no access issue in our state. We need the optometrists in our state in their offices working collaboratively with ophthalmologists to care for the vision needs of our patients, not injecting medications that are readily available in multiple locations. Thank you, and I'm happy to answer any questions.
Thank you for your testimony. Seeing none again?
Okay.
Have a great day.
And these are maps showing where the Medicare-enrolled mass immunizers are.
Okay. If you just, she's going to come get it from you. I thank you very much, and you have a great day.
You too. Thank you.
Dr. Kimberly Liccardi. Yes, ma'am. Okay. Good morning, doctor.
Good morning. My name is Dr. Kimberly Liccardi. I'm an ophthalmologist. I've been practicing in Manchester for the past 13 years at New Hampshire Eye Associates, and I'm currently the president of the New Hampshire Society of Eye Physicians and Surgeons. We are opposed to SB 200 as it is currently written, specifically to the portion regarding vaccination. The wording of the bill, our concern is that it leaves the door open for optometrists to be distributing vaccines through their office. And this is concerning for a few reasons. One, it would require a significant capital investment in the vaccine, its proper storage, sharps disposal, and so forth. Pressure to recoup the investment could lead to poor patient selection, administration of unnecessary vaccines, increase in adverse reactions, and poor outcomes due to the inability to handle such events. Managing an adverse event alone in an office, particularly by a provider that does not have experience with basic life support, airway management, and so forth, is vastly different from managing one at a mass vaccination site where you have an entire team of nurses and paramedics present. One may argue that the pharmacists are not trained in basic life support. However, pharmacists are at least extremely well trained in the safe handling and preparation of medications, which would lead to fewer adverse events. When you put the vaccine in the hands of someone who is both poorly trained in medication storage and preparation and also has no hands-on experience with managing severe reactions, we've created a potential bad situation here. The optometrists have expressed their desire to assist with the public health emergency and claim this is the purpose of the bill. The timing of the bill is a little bit late, as presently we have no shortage of providers available to administer vaccines. There's no longer any issue with access to vaccines. In fact, there's an abundance available to New Hampshire residents. You can get them at almost any retail pharmacy. And as you can see from the maps that Christy distributed, everyone basically lives within a 30-minute drive of a mass immunizer. The second map that she has shows where the optometry points of service are located, and there's none that catch any of the areas missing from those catchment areas. So it doesn't actually increase access by using optometry offices. The COVID-19 pandemic is coming to an end. Should another public health emergency occur that would require mass vaccination, it would most likely be a novel pathogen and would not specifically include those 3 vaccines that they've requested privileges to administer. So it would probably limit their ability to participate in future epidemics. Now, optometrists are a vital part of the healthcare team. Poor vision leads to increased morbidity and mortality. The optometrist's focus needs to be on their field of expertise, which is diagnosing and treating the patient's ocular problems, not selling vaccines. We did learn from the COVID-19 pandemic that broad shutdowns and putting off other medical care led to exacerbations of existing medical conditions and delayed treatment of new medical conditions. Should another pandemic arise, the optometrists need to be continuing to care for their patients who have conditions such as glaucoma, which can lead to permanent blindness if you defer treatment. I see SB 200 as it's currently written as a slippery slope of compromised patient safety that likely won't enable optometrists to volunteer when the next public health emergency arises. Any
Thank you
questions?
for your testimony. We have very few questions today. Thank you very much.
Thank you.
Dr. Dorothy Hitchmoth. Hope I didn't butcher that. Good morning, doctor. How you doing?
Good morning. Happy Valentine's Day. I'll
Happy
try not to
Valentine's
take
Day.
too much time. So I'm Dr. Dorothy Hitchmoth. I've been in practice for 27 years in New Hampshire. For 22 of those years, I was at the VA hospital in White River Junction that serves the 2 northern counties, as you may all know, in New Hampshire. I'm now in private practice in New London, New Hampshire. When I was at the VA, I was the chief of services for my entire tenure. And as part of my experience there, I can tell you that we did injections all the time with various different medications, to include intravenous medications for other testing that was required to save sight. I am not here this morning to have a squibble with our colleagues in ophthalmology. I'm here to advocate for patients. That is the sole reason I'm here. My entire career has been dedicated to advocating for patients. In fact, in March of 2020, when the COVID pandemic hit, I joined the Medical Reserve Corps in New Hampshire because I thought it was the right thing to do. I was quite surprised when that happened that of all the providers that were sort of in the drop-down menu to sign up for vaccinations, that we were seemingly specifically excluded. Nonetheless, I wanted to help. I carried forward with my volunteerism and ended up doing medical triage, which actually, in fact, where I agree with my ophthalmology friends here, was probably a better use of my skills. So I was on hand to do appropriate medical triage, as I have been trained, to make sure we were not vaccinating people that might be high risk or inappropriate to vaccinate at that moment, and also was on hand as part of the emergency management system, as I was in advanced cardiac life support in the hospital for our entire floor. The implication that optometrists who are doctors are not trained in emergency medicine for procedures that occur in their office is false. We administer all kinds of medications all the time. We prescribe all kinds of medications all the time. And I will also further attest to the fact, as a board of trustees director at the closest optometry school and a professor of optometry and medicine for almost 3 decades, that the training is in place, and I'm happy to specifically answer any questions about that. But I am well versed in the curriculum. I have to approve curriculum, and I've provided direct clinical training to medical students, medical residents, optometry students, and optometry residents. I have testified in front of legislative bodies many times, and in the process of doing so, have been asked to provide facts about the training, to include the Secretary of State in Vermont, twice, and most recently 20 years ago, and most recently last year, and also to this body. So I would love to answer any questions that you have or dissolve any fears that you may have about the training of a highly qualified group of doctors who really stands ready to advocate for patients. We have no financial benefit that will come from offering our services in our offices. And let me just further state in conclusion here, we're distributed throughout the state. And one thing that we know as a profession is that we have longitudinal relationships with patients. They know us, they come to us, they trust us, and we have every opportunity and take that opportunity all the time. And I would not expect our friends in ophthalmology to know this, because this is quite frankly our job, but we are on the prevention front lines, and that is something that we hold near and dear and would love to be able to continue to do across the other services that we provide to the citizens of New Hampshire. So I'm happy to answer any questions.
Go ahead, Senator.
Thank you, Mr. Chair, and good morning, Doctor. I may have missed this in earlier testimony, so forgive me if this is repetitive, but are optometrists granted these privileges in other states specifically?
Yes.
And if I might follow up, would you know how many or?
22.
Great, thank you very much.
Go ahead, Senator.
Aren't there a number of practices in this state that have both optometrists and ophthalmologists on staff? Aren't there several, certainly in larger communities anyway?
Yeah, definitely in the larger communities, in our rural, less served communities, it's largely just optometry.
Okay. And last question, if I may. And isn't this voluntary? So if a practice chooses, because they have the ability to maintain a quality of service and care for the vaccine or properly refrigerate them, they can do so, but we're not requiring optometrists to now provide vaccine.
Correct.
Thank you.
Hi, Doctor. I'll just ask you a little question. So I'm certainly not going to debate you on whether you're trained or not, and I think you probably are. But it would be more the need issue. I saw these charts, and it seems like everyone already has access. So is there really a need?
So I think there is so let me back that up and say, do we have a good distribution in New Hampshire of providers that can provide vaccines? Yeah, I do think we have that. Why would we not have doctors also on the rolls if in fact there becomes a need in the future or now to provide vaccinations that can actually prevent vision loss? So my specific interest in this is the Shingrix vaccine. I see patients on a regular basis, like weekly. Like I largely care for people over 65 with poor immune systems. Many of them have not had the shingles vaccine. It is important for them to get the shingles vaccine. Unfortunately, many of you may not know, but this shingles infection on the face can actually lead to blindness. Even when it doesn't lead to blindness, it's a horrible experience for the patients, and it can be long lasting. And we have good data that says that that particular vaccine can actually prevent the depth of the infection and the long-term and short-term outcomes. So I just think it's a great idea for the state to have optometrists who are well distributed across the country, across the country and the state, to be part of the core medical group that can deliver this stuff.
Senator.
Good morning, Doctor. Thank you for your testimony. I was wondering, I have my eye doctor and I have my primary care. And my primary care has all of my history, all of my medical history, knows everything about me. How would how would you know it's safe for me to have these certain vaccines without having the background that my primary care has?
So we actually do take full medical histories and we share records with primary care all the time. So in my office, would be inappropriate not to know every single one of your medications, your full medical history, and to not ask you all of those questions. If vaccinations were also to be administered, there would be a whole host of additional questions that would be appropriately asked, and every single doctor of optometry is well versed in that. So, where do I think the best place for vaccinations to occur? Let me go out on a limb here, which is not in support of the bill, would be in the primary care setting. But, quite frankly, I was just asked to write an editorial. I'm a regular healthcare writer. How are eye doctors going to prepare for the lack of primary care? In my community in New London, right now, which is a small community, we have lost 7 primary care doctors in 10 months. There's no more primary care docs taking new patients at Dartmouth Hitchcock 30 minutes north of me. So to me, the writing is on the wall, and it would be better for us at this point, where we don't have a pandemic and we don't have a crisis, to do all we can to bolster the fine docs that we do have in the state and take full advantage of the training that they do have. That's my opinion.
So my eye doctor always asks what medicines you're on, supplements, because it can impact the eye. But my eye doctor doesn't listen to my heart, doesn't check my blood pressure, or have a full handle on everything medical. You said that if this were to pass, that there would be a whole new system for asking questions and things. Does the bill say that?
Yeah, actually, it goes into quite detail, in my opinion, that we're going to ask all the appropriate questions. I can get to the specific statutes. We've agreed, even though we don't think we need it, to go through additional immunization training that the CDC specifically provides, and also participate in adverse reactions with the vaccine reporting system. So there are a number of things that we built in to hopefully allay fears. I will tell you that I had my flu vaccine and my 3rd COVID dose at my local pharmacy office. They did not listen to my lungs. They did not listen to my heart. They did not ask me any medical questions and did not ask me for a list of medications. They did go through the appropriate list that would indicate whether or not I had contraindications to the vaccine. So I think, if you look at the specific issues of vaccines, I think that we're well in alignment with what is required and what is actually best practices throughout the rest of the medical world.
Thank you.
Side question. It's just I always follow the money. You're opening yourself up to liability, obviously. I know you're doing this for altruistic reasons. In the other 22 states, do the insurance companies have any problem with optometrists doing this type stuff, and they're not increasing your rates? Or
Absolutely not. And in fact, in other states where we perform laser and surgical procedures, our malpractice rates haven't gone up, and those are much more dangerous endeavors, if you will.
Okay, thank you for your testimony. Seeing no other questions, have a great day.
Thank you.
Does anyone else who didn't sign in wish to testify? Seeing none, thank you. I know about it. We're going to take a 5-minute recess. Thank you. Senator Perkins Coker, you're introducing SB 198. Take your time, get your papers ready, and then go for it. And press your red button.
Thank you, Chair, and members of the committee. I'm Senator Rebecca Perkins Quokka of District 21, here to introduce SB 198. SB 198 would create a study to examine the cost of expanding group health insurance coverage for same-sex couples and single individuals undergoing assisted reproduction treatment. While current coverage does exist, in some cases it is debatably not the same between same-sex couples and heterosexual couples. As it currently stands, there's some testing that sort of differs between the two groups. And so in order to receive the same insurance coverage, there's some additional testing. I think SB 198 is just a first conservative step towards us finding out what the cost burden would be to move this policy forward. And we may encounter some practical challenges along the way, but I think that we owe it to this constituency to just kind of find out what the cost would be to the private carriers and see, and to do some more investigation. The bill does not make any appropriations or requirements. It simply recognizes the practical challenges that providers face while aiming to assess the barriers, namely the cost of coverage expansion, to help chart a path forward towards full equality. And I don't know if the commissioner was able to stay. I spoke with the commissioner of insurance, and he mentioned that, they have no opposition to this bill. They're also enabled to do something similar with the approval of the committee. So the legislation in his mind creates no issues. Can I ask any questions?
Let's see if
I'll take any
do we have any
questions.
So it's just me and you, just chatting. You can have tea anytime in my office, we can chat. So it includes so it's just private insurance companies.
Correct.
It's, it included single, I understand LGBTQ and lesbian, that's fine. And then it's also including regular married women could get this?
So regular heterosexual couples are currently covered under private insurance. And so the issue is just that there's some additional testing that's done for same-sex couples. And so we're just looking at the cost of sort of bringing coverage to the same point, sort of the diagnosis of infertility for same-sex couples.
Gotcha. And this would also include all single women in the state?
It should, yeah.
Okay. So we have 1.4 million, whatever we have, hopefully more and more keep coming here in our population. We'll roughly say 700,000 are women. We'll say half of them are reproductive years, so 350,000. We'll take off because we're not going to cover, as I spill water, we're not going to cover state employees, right? They're not covered, so it's just private. So now we're at we'll just roughly say 250,000, my quick math.
Okay.
And so this could be in vitro costs of $50,000 for potentially every single one of those 250,000 women, potentially.
Well, it's actually just a subsection of that procedure. So there is some coverage available to same-sex couples now. It just starts a little later in the process. It requires some additional testing. And so what we are looking at is just that sort of very small portion of the IVF procedure that differs between same-sex and heterosexual couples.
Just tell me a little more about the particular IVF procedures.
Sure.
And do you have a rough idea what the cost per procedure is?
I don't know the cost. In speaking with the commissioner, he did not expect it to be a big number either.
Okay.
And so I think that's what we're trying to figure out. But essentially, a heterosexual couple can come to a fertility provider and self-report as infertile through efforts at home. And a same-sex couple needs to sort of undergo 6 months of testing to sort of prove their infertility. So we just want to line that up.
I am good. Do we have any other questions? Senator Ricciardi, remember we were talking before? No?
I'm set now.
You're set. Okay. Thank you very much, Senator.
All right. Thank you very
And
much.
don't leave our room. Oh, you staying here?
I'm not.
For our next bill?
I'm going right over
Okay.
here.
We're gonna keep a tight hold of you. Kathleen Tucker. Hi, Kathleen. Good to see you again.
Good morning.
Mr. Chairman, members of the committee, I'm Catherine Tucker. I live in Concord and I have a law office in Loudon. And I'm also here on behalf of Resolve New England, which is our regional infertility advocacy organization. So let me just start off by saying that there are not 250,000 single women in this state who want to have a baby by themselves. It's a small number who want to have a baby by themselves. And most of those women do not need to go to IVF. IVF is about $12,000 per round of IVF. Most of them are not going to need that. Most of them can get pregnant via a simple insemination process performed in the doctor's office using donor sperm. And the donor sperm, of course, is going to be purchased by the patient. That is not a medical cost, and that is not what we're looking at in this bill. We're looking at just the medical costs, the placement of the donor sperm into the woman. And if that doesn't work after a number of tries, she may actually be medically infertile and need to proceed to higher technology, but that's going to be a very small subset of folks. So we do have existing coverage that came through this committee 4 years ago, and thank you, committee members, for your support in that. There's still a gap in coverage. So we really started this process wanting to be comprehensive for all prospective patients who need fertility treatment, both those who are medically infertile and those who are socially infertile. And when I say medically infertile, I'm talking about couples like my husband and me. We had bad eggs, bad sperm, bad uterus. We needed a lot of stuff to get it fixed. And fortunately, we were lucky and able to have a couple of kids. But there's also social infertility. That's people who are not in a relationship that allows them to have a baby. So female couples, male couples, and single individuals. Our problem was 4 years ago that we only had cost data for that one subset, the medically infertile, folks like me. What we want to do now is to get the cost data for the rest of those folks, those single individuals and the gay and lesbian population who wants to have kids. No one has done this specific cost study. I wish I could find it and show it to you so we could skip this process, but it's not out there. Maine was supposed to do this a couple of years ago. However, their cost study, when you look at it, they never segregated out the gay and lesbian population from the medically infertile population. So we really don't know what the specific costs are related to the gay and lesbian population. And what we're really going for is what we've seen happen with straight couples is that they're going to make better choices when they have insurance coverage. They're not transferring 3 or 4 embryos. We're not going to end up with an octomom situation. That's where the real costs are to the health insurers. When you get twins or triplets who are premature, you've got not only that high-risk pregnancy that you have to cover, the NICU costs, which are atrociously expensive, and these children have lifelong medical costs that need to be covered also. All of that is a lot more expensive than simply paying for IVF or IUIs to be done in a manner that follows best practices. And we'd certainly anticipate that if at some point in the future we get to the point of having a bill, there would be requirements for patients who get coverage to adhere to best practices in their treatment. And really, it's also a matter of equity because gay and lesbian couples and single people, they're paying their insurance premiums just like everybody else, and they need to be able to access the costs for care. So again, this is just medical costs. It doesn't include getting the sperm, getting the eggs, whatever else you need to do. And I understand that the insurance commissioner says that this can be accomplished without passing a law, which is great. We're absolutely on board. However this is done, we would just like to get that data so we can then make decisions moving forward.
Thank you for your testimony. Any questions? Oh, go ahead, Senator.
Thank you for your testimony again, and good morning. So last year, I had tried to pass legislation to reduce health premium costs for people because we pay so much in the Granite State. And it is a huge problem. And be it all that we do have these mandates all along that we've done to protect people, which I do support, but it keeps rising the cost. It's just a question maybe for the insurance department, but wouldn't it make sense instead of distributing the costs for some of these different situations to have some sort of protections in a rider or something? I'm trying to get to a place where we're reducing costs for people. I mean, that's really what I was wondering. It's like, I see the value, but I don't like the thought of insurance continually rising. It's becoming unaffordable for people to have their insurance.
I absolutely understand, and I just want to be clear, we're just looking to do a cost study right now. We are not jumping ahead to any kind of mandated benefit. Just right now, let's find out what the costs are so we can make decisions moving forward. Maine had considered the option of a rider, and they said it really wasn't a good idea because the only people that would buy that rider are people who know that they need infertility treatment. And so it would not be a good way to spread the costs. But it's definitely something that we could consider, and I think that a cost study should look at it from that perspective.
Thank you.
Seeing no other, oh, I'm sorry, Senator Susie.
I actually have one prompted by something you said earlier. So if the department is willing to take on doing the study, and we'll do it, you just want to be sure that the study includes both groups of people, both single women making an affirmative choice to have a child and gay lesbian couples as well.
Yes,
And that there's a clear distinction between the two because the costs may be different for different reasons,
yeah, exactly, because we don't know. And also just to add into that, single men who are, less commonly going to pursue the single parenthood path, but they are out there too.
Okay.
Thank you very much. Seeing no other questions, thank you very much for your testimony.
Thank you.
Does anyone else wish to speak on 198? Seeing none, thank you. I don't know if you heard, I think the next one's gonna be long. No, thanks, yeah. What's that? Oh, okay, okay. Gotcha. Thank you. Weesh. Oh, boy.
Senator, I apologize in advance for the jacket. It's just warm.
I take no disrespect.
Senator Perkins, good to see you again.
Good to see you as well.
Go ahead. Senator Perkins Cook is going to introduce 145.
All right. Mr. Chairman and members of the committee, thank you. I am Senator Rebecca Perkins Quokka from District 21, here to introduce SB 145 relative to the New Hampshire Housing Champion designation for municipalities and making appropriations therefore. This bill is relatively simple. It will establish a voluntary housing champion program for municipalities to access state funds to tackle our affordable and workforce housing crisis. As it currently stands, housing vacancy rates are at 0.5%, and we are short at least 20,000 units across the state. Here's how this bill would help. Municipalities would apply to the New Hampshire Housing Champions program and be accepted into the program based on a commitment to policies that promote workforce housing. Such pro-housing policies include zoning ordinances that promote workforce housing development, improvements to sewage and water infrastructure, and building out sidewalks and public transportation. To help municipalities get to this planning stage, the bill establishes the Housing Planning and Regulation Municipal Grant Program with a $1 million appropriation that will aid municipalities in enacting these positive initiatives. Once a municipality is deemed a housing champion, they become eligible for 2 pots of discretionary funding. The Housing Production Municipal Grant Program, which includes grants for newly constructed workforce housing units on a per unit basis, totaling $3 million in appropriations. And the Housing Infrastructure Municipal Grant and Loan Program, which supports new construction or capacity increases for drinking water, sewer, telecommunications, and other infrastructure, totaling a $25 million appropriation. This bill is a product of bipartisan work and one that can empower the growth of workforce and affordable housing while respecting local control. Specifically, SB 145 helps break down existing barriers to housing development that include a reluctance to increase workforce housing due to concerns about the impact on water and sewer infrastructure, safety services, and schools. I think we all know with the cost of water and sewer quickly reaching $2 million a mile, that being able to support our municipalities at the state level in this way is impactful. Our housing crisis is one that touches all aspects of life here in New Hampshire,
This bill is for our small business owners who are struggling to attract and retain workers. It's for our community mental health centers and hospitals who face hundreds of shortages and are unable to compete with neighboring states. It's for our working families who want to call our beautiful state home but are left with few options to do so. I ask you to vote out to pass on this critical bill, and I'm happy to take any questions.
Does the committee have any questions? Senator, you made my day go very long, but I thank you anyways. Thank you for your testimony. Have a great day.
Thank you very much, committee.
I'm sorry, Senator Ennis. Seeing that I have dozens of people who want to speak, we're going to limit it. We're going to try for 3 minutes. So if you have something written, try not to read it. Just talk to us, and that'll be a more effective use of time. Try not to repeat things we've already heard. That being said, Natchez, how do I say your name again? You want we go through this? Nates. Okay, we'll get there. Good to see you today.
Thank you, Mr. Chair. Nate Graves with the Municipal Association. We support this bill. I think there are really 3 points that I just want to make. That this is a voluntary change program in exchange for access to new money for infrastructure designed to help solve the housing shortage. This completely voluntary program is designed to help municipalities ease the housing shortage by investing in the specific kind of infrastructure that we need to make housing cheaper, and that's just regular houses. So when we talk about water and wastewater infrastructure, we're talking about public water and sewer lines, which means we don't have to put in things like radon mitigation units in people's basements like I have in my house, which makes it a bit cheaper to build that housing. And this incentivizes the investment in this type of infrastructure that we haven't really seen in the past, or we haven't seen for a long time, which is going to help municipalities that are interested in looking at their zoning and changing their zoning to have smaller lots, higher density, walkable neighborhoods, and promote economic growth. And we think that could be very important. I know there are many people after me who can talk with more detail, so I'll leave it at that. I'm happy to take any questions the committee may have.
Seeing no questions, thank you for your testimony.
Thank you.
Michael Thornton. Welcome, Mr. Thornton. Good to see you.
Thank you, Chair and Senators. Thank you for hearing my testimony. Michael Thornton, District 43, Milford, speaking for myself only. Milford has an affordable housing shortage. Homeowners are somewhat at odds with apartment dwellers, and seemingly very few are willing to accept the concept of teeny homes or more auxiliary dwelling units, or even more apartments for that matter. Their argument is simple, that as homeowners, they're carrying a greater portion of the load and paying higher taxes. Meanwhile, people crash on sofas, on their friends, live in their cars, or worse. Businesses in town need workforce housing. Even schools, according to them, suffer because nomadic children have difficulty learning and their proficiency scores drag down the average proficiency scores. This housing shortage is a societal problem. And the plan as it's written, the bill, seems to encourage an integration, a creation of the master plan in our town, the community investment program, the capital investment program, and the budget advisory, and the whole process is a little bit disjoint. I would like to see it personally come together a little bit. I very enthusiastically support this program with its carrots. My only concern is simple. What are the obligations? What are the strings that might come with it? I would appreciate your support for this bill. Thank you for the opportunity to present my testimony, and I'm willing to answer any questions.
Thank you, Mr. Thornton. Seeing none, thank you for your testimony. Michael Skelton from BIA. How you doing, Mike?
Great, Senator. How are you?
Could not be better. Well, I lost a little money on that game. We won't talk about that.
Good morning, Senator, members of the committee. I'm Mike Skelton from the Business and Industry Association of New Hampshire. We're the state's Chamber of Commerce and Manufacturing Association, leading business advocate. We represent more than 400 companies across the state that have more than 100,000 employed individuals and contribute more than $5 billion to our state's economy. And we're here in support of Senate Bill 145. I do have written testimony that I will not read, but leave with you, and just want to summarize a few key points. I've been in my role at the BIA for a little more than a year. I spent the first 6 months on the road meeting with as many members as possible. The first issue they wanted to talk about was workforce availability, as I'm sure you are well aware, and how the significant challenges that poses to businesses of all shapes and sizes across all industry sectors. At that point, the conversation generally went straight to housing, and their concern and their understanding that housing affordability and accessibility in their area of the state was a direct connection to their ability to grow and sustain their workforce. And we as a business organization have taken that to heart, and over the past several years have been very active on a number of housing policy issues. And we think this bill is another positive step forward. I do want to acknowledge and recognize that I think we have made some great progress in the last few years. The legislature has added funds to the state's Affordable Housing Fund. We've added the ability for accessory dwelling units. Importantly, a marquee accomplishment, I think, was the creation of the Housing Appeals Board. But there's more work to be done. As I'm sure others will speak to, the statistics and data show that our housing market is out of balance. It's too costly. It's prohibitive for some to enter, and that has an impact on our workforce and our state's quality of life. Which brings us to this proposal, which we think is a really significant and unique step forward, a creative approach that recognizes that carrots and incentives work better than top-down mandates. I think we know that in New Hampshire, a top-down mandate that dictates to communities what they must do is not going to work. And we need to create a program that incentivizes solutions. Every community has a role to play in making housing more affordable and more accessible. But those specific plans in each community could look very different. And they do look very different depending on what part of the state you're in. And having this new program based within state government and partnering with local communities, I think will provide an excellent roadmap on how we can develop each community's individual plan for how they can play a role in shaping and solving our state's housing and affordability crisis. Just to restate again before I close, the importance of this issue we see as tied to our state's workforce. It does not matter what industry sector or what size of business I'm speaking with. This is a top concern, and it's likely going to take steps like this over a number of years. We can't create 20,000 new housing units with one silver bullet solution. It's going to require a lot of different unique approaches. We think this is a logical, thoughtful, creative next step forward for us to pursue. I'd be happy to take any questions. Thank you for your time this morning.
Thank you, Mr. Skelton. Seeing no questions, thank you.
Thank you.
William Sherry.
Morning, Senators.
Morning.
Upset about the results on Sunday night, so we'll just leave it at that. Bill Cherry from Granite United Way. Thank you for your time this morning. I also have some written testimony that I'll leave with you just to summarize briefly. Granite United Way is the largest United Way in New Hampshire. Through our programs and services and donors, we interact with approximately 1 out of 3 people in the state. Access to affordable housing is key to healthy communities, healthy children, and healthy families. This bill provides voluntary opportunities at the community level for people to work together and create another tool in the toolbox for communities to help build affordable housing. We're in the business of helping people. That's primarily what we do. Financial stability, early childhood education, addressing homelessness. It cuts across all of those issues, and access to affordable housing is a key component to it. So I'll leave the rest of my remarks with you. Any questions?
Thank you, Mr. Chair.
Hearing none, have a good day. Thank you.
Thank you. Have a great day. Bill Stewart.
Thank you, Mr. Chairman, members of the committee. For the record, my name is Will Stewart, and I'm the Executive Director of Stay Work Play New Hampshire. We're a statewide nonprofit whose mission is the attraction and retention of young people here in the Granite State. And we're here today in full support of this bill, as we are most bills that seek to increase both housing and housing affordability here in New Hampshire. It is the #1 issue facing young people in New Hampshire. We've been doing nonpartisan issues-based advocacy for 4 years now, and housing year after year continues to be that #1 issue. And I'll echo, Mr. Skelton's remarks that, great progress is being made, but we have so much more to do. And given that so much is at the local level, we really think this bill has the potential, to help move the needle any further. Happy to answer any questions anyone might have.
Thank you for your testimony. Seeing none, thank you very much.
Thank you.
Ben Frost. Did you want to bring someone else up with you? Do a 2 for 1?
We are tag teaming.
Okay.
I'll be alone here today. Thank you, Mr. Chairman.
Thank you.
My name is Ben Frost. I'm the Deputy Director at New Hampshire Housing. We are an independent state entity. We receive no operational funding from the state. And I'm here to express New Hampshire Housing's enthusiastic support for Senate Bill 145, which recognizes those municipalities that are trying to do the right thing and provides resources for them. 10 years ago, we were administering a federally funded grant program that we designed called the Community Planning Grant Program. Provided resources for municipalities to do innovative local planning and regulatory development. I have a booklet of case studies here that I'll give to you that shows exactly what municipalities can do, the brilliant things, the extraordinary things they can do when they have the resources to do them. And really, that's what this bill is all about. That was a $1 million grant program administered over 3 years. We provided about 45 grants in that period of time. Fast forward to now. New Hampshire Housing is administering on behalf of the Department of Business and Economic Affairs a portion of the Invest NH initiative of the governor. It's a $5 million planning and zoning grant program. In the first 6 months of its administration, we've made over 40 grants totaling over $2 million. The need for these resources is extraordinary. Senate Bill 145 creates the Housing Champion Designation Program, and it will pick up where our program leaves off when the funds are done, when the program is over. Too often, we seek to punish bad actors, so sue them, we might say. This legislation does just the opposite. It recognizes those communities that are trying to do the right thing and desperately need the resources to do it. What they want to do is to create, and what we're asking them to do, is to create a housing-friendly regulatory environment where developers see better opportunities to develop housing that we need, as you've heard. Senate Bill 145 creates that program, provides the resources, and we strongly encourage you to find this ought to pass. Happy to take any questions.
Thank you for your testimony. Seeing none, thank you very much. Wendy Hunt.
Good morning.
Good morning, Wendy.
I will be very brief as I echo the words of Mr. Skelton. Mr. Stewart and Mr. Frost. I will tell you, I represent, or the Greater Nashville Chamber of Commerce represents over 400 businesses of all sizes, large, small, nonprofits, all sectors, manufacturing, retail, hospitality, healthcare, and so forth. And without exception, whenever I sit down with their staff, with their CEOs, their main concern is workforce and the workforce that they lose due to a lack of housing. We have made great strides, yet we still feel like in the greater Nashville area that we're definitely still in a housing crisis. So I'm here to support on behalf of all these chamber members, SB 145. I would just like to read one thing that, you know, when you try to prepare for testimony, knowing who you're following and you don't want to be redundant, there was a great op-ed written by the Housing Champion Coalition that really best states this. New Hampshire has the opportunity to serve as a national model on how to address the housing issue. We can model how to build more housing while protecting our beautiful natural resources. We can add homes to a community and protect its rural character. We can bring communities into the process to proactively envision their future, and we can make sure that our state government is supportive by providing the resources where needed. The Housing Champion Program takes a long view by letting towns and cities decide if they want to continue offering recertification every 3 years. In addition, the state funding connected to the program will provide needed relief to tight municipal budgets by returning taxpayer money to our towns and cities in connection with this important state goal. Thank you for your time. I will leave you copies of my more detailed statements, but highly encourage you to recommend this ought to pass. Thank you.
Thank you, Ms. Hunt. Any questions? Seeing none, thank you. Joan, I want to say, Joan, how do you say your last name? W-Y-H-A-N? Hampton Area Commerce? Oh, John, okay. See, the nuns got to me. The one thing they can read that I write is my name. But I'm almost there. Good to see you. I missed an event, your Chamber of Commerce event. I had a daughter's basketball game, so I apologize. Good morning.
Good morning, and I will also keep my comments short. Name is John Nyan, President of the Hampton Area Chamber of Commerce, and I come before you today to support this very, very important Senate bill. It is critical, in my estimation, that we move forward with positive solutions for the workforce housing, affordable housing efforts here in the state of New Hampshire. I also was asked to present a letter from the Seacoast Chamber Alliance, which includes 6 chambers in the Seacoast area. We have over 2,500 business members, 20,000 employees representing those businesses. And the number one concern, the number one issue is housing. And I believe this is a strong effort to move forward. I myself am responsible for 5 different communities, from Seabrook all the way up to Rye. And each community has its own issues. But let me highlight just one, and that is Northampton. Northampton is struggling right now between the business community and the municipality with regard to the option of water sewer. They do not have it today. We're trying to find solutions that would convince the municipality, the zoning and the planning board of that particular community to look positively towards some type of arrangement where we could create that type of business community system for housing. I think it's critical that these types of volunteer options are made available, which would encourage, in my opinion, members of the local municipality and the planning and zoning to participate in such a program. So I wholeheartedly support this bill, and thank you very much for your time.
Thank you, John. Sorry I butchered your name. Does anyone have any questions? Seeing none, have a great day. Speaking. Alyssa Margolian. Had to do halfway decent on that one. How you doing this morning?
Good, thank you, Mr. Chairman.
For the record, my name is Alyssa Margolin. I serve as Director of Housing Action New Hampshire. We're a statewide coalition of 80 organizations and businesses united around affordable housing policy. I am sharing with you the op-ed that the prior testifier just referenced that ran a New Hampshire Business Review. Also a letter from the Housing Champion Coalition, as well as my written testimony. I won't repeat many of the excellent points provided by prior testifiers. What I thought I would do is just, since we've been involved in the advocacy around the housing issue for many years, just kind of give you our perspective. This proposal came from the 2019 task force put together by Governor Sununu to start to address the housing crisis. And I'm happy to report that this proposal has evolved and improved, and really improved because of this coalition and our partners. We were able to get the perspective of the business community and really able to understand from the municipal association really what is a carrot for a municipality, what is a true partnership, what are the actual barriers where the state could be a helpful partner, and meet them to those communities that are meeting that market need, that's waiting there to address the need for more workforce housing. So we're really pleased that we have such good company in asking you to support Senate Bill 145. And we think this is now ready for prime time, and we urge your ought to pass recommendation. Happy to take any questions.
Thank you for your testimony. Seeing none, have a great day. Christine from the city of Manchester. I'm going to guess it's Faye Arito? Okay. Then I'll say I got it right. That's why they never let me self-grade in school, because I always thought I did well. Let's see. Harrison Kneller.
Thank you, Mr. Chair, members of the committee. My name is Harrison Kanzler. I'm the executive director for AHEAD. We're located in Littleton. We are a nonprofit affordable housing developer, manager, and educator for Northern Grafton, Northern Carroll, and Coos County. Hugely in support of this bill. I think it's a wonderful opportunity for our state and for our communities, especially our rural communities. I have been in this position for 6 months, and I've had 3 municipalities reach out to me, asking me how we can partner with them, what we can do to help them solve the housing crisis that their community is facing. And I will speak most heavily to specifically the infrastructure piece of this bill. That is a huge problem as a developer that we run into in rural communities, is whether or not we can actually fulfill their housing needs based on whether or not they have the infrastructure that we require in order to make that all work, especially in rural North Country. Obviously, the outdoor rec space is a huge part of our economy. And so being able to have access to infrastructure funds to ensure that we're growing in an intelligent and planned way so that we don't have housing developments taking up huge swaths of land because we can build them a bit more densely and confined more to a kind of central location within our municipalities is an integral part of making sure that that economy continues to thrive. Thank you very much.
Thank you for your testimony. I see no questions. You're a free man. Maggie Randolph. Morning, Ms. Randolph.
Thank you, Mr. Chairman, and to the committee. My name is Maggie Randolph, and I'm an architect and the owner of GSD Studios out of Exeter, New Hampshire. My husband, John, and I are the owners and builders of the cottages at Back River Road, an affordable housing project in Dover, New Hampshire. We are currently under construction to build 44 freestanding cottages that will remain as affordable rentals in perpetuity. Building affordable housing is not easy. Because we are using private funds entirely for our project, the idea of which was started in order to offer additional support to our staff at Harmony Homes Assisted Livings, we work very hard to stick to our budgets, something that is difficult when facing the supply chain issues, volatile markets, and inflation that we all contend with. In order to make our current project in Dover work, we operate with as little overhead as possible and include no profit in our construction. In fact, we have personally invested hundreds of thousands of dollars to make this project work. I share this with you to tell you that this project would not be possible without the innovation and support by the City of Dover. We are able to utilize a zoning program that enabled us to receive approval by the city in a very streamlined process that cut down on the overhead expenses dramatically. We chose Dover because not only did they have the municipal infrastructure, but because we did not have to fight a municipality in such a way that would have been cost prohibitive to the project. With their creative zoning that enabled us to increase the density of the single-family zone, we are creating 44 units of workforce housing available to those making around $45,000 a year, instead of 9 single-family homes that would sell for $700,000 or more. Dover championed our project, and because of them, 35 additional homes are being created. Our state needs more champions. We would like to continue to build affordable housing, but need more municipalities to be willing to support projects through improved zoning and regulatory processes. Ideally, these projects would also be able to utilize public water and sewer so as to best support the necessary increased density. I feel that support of the Housing Champion Bill, as administered and supported by the Department of Business and Economic Affairs, is what the state of New Hampshire needs to continue to address the housing crisis, not just for where it is now, but to avoid where it may end up. Thank you
Thank
very
you for your
much.
testimony. Are these the little tiny houses I saw on TV?
Yes, sir.
Okay, they look really nice.
Thank you.
Thank you. Is your husband going to testify?
Next, yep.
Geez, my wife can speak for me.
I try and speak.
I want to
for
see what he adds to the mix here. Okay, thank you very
Thank
much
you.
for your testimony. Come on up, John. You're going to have something good to say. She was really good.
It was hard enough to follow, but the second it wasn't a hold. So just kind of get that out front. Good morning, Mr. Chair and Senators. Thank you for having us this morning. I know you want to keep these timely. I am going to read my testimony because I can fly through it fairly quickly, so bear with me. Good morning. I'm John Randolph of Exeter, New Hampshire, owner of Harmony Homes Assisted Living and GSD Construction of Durham, New Hampshire. Although we are starting to realize how bad the current affordable housing shortage is, we simply do not know how bad it's going to get. How many companies do you know that are currently attempting to hire? Nearly every single one that we come in contact with a day-to-day basis is attempting to hire. Harmony Homes would like to build a much-needed skilled nursing facility in Durham, but there's a moratorium against it, and one of the major justifications is lack of staffing. The housing shortage is making it extremely tough to sustain a business in New Hampshire and nearly impossible to grow your business. New Hampshire needs to address not only how to provide affordable housing for those already in the state, but also how to build housing in order to attract new individuals and families to our state. I'm not sure if we've heard of anyone truly calculating of where affordable housing needs will be 5 to 10 years from now. But in order to continue the economic stability and growth we enjoy, we need to. We can see from our current dilemma what happens when we don't plan ahead. It is my firm belief that if we do not take drastic steps to address the housing needs in the state, we are not far from a time when companies that are mobile will leave our state and others will simply close. By the end of 2023, GSD Construction will have added 51 affordable units to Dover and Durham, not even a drop in the bucket for what is needed. We are currently searching for land in New Hampshire to continue the goal of building more affordable housing, but the margins for building affordable housing do not allow for a lengthy planning process with municipalities. In order to build affordable housing, we need welcoming municipalities like Dover, and we are currently trying to wrap up those 44 homes with them. It is time to be creative on housing solutions. We need municipalities that are housing champions, welcoming affordable housing to the communities. Please support the Housing Champion Bill, SB 145. We believe it is an investment in New Hampshire that will pay back for decades to come.
Thank you for your testimony. Thank you for the work. I like the houses. Are those going to police, teachers, firemen, essential services? Do they get a preference?
Well, we will obviously offer them to Harmony Homes employees, our LNAs, caregivers in the neighborhood, but we're actually working with several other agencies, including the area hospitals, to support them.
Great. Thank you very much.
Welcome.
Seeing no further questions, thank you. Chris Norwood.
Good morning, Mr. Chair, members of the committee. Everything has been said, so I will be brief. My name is Chris Norwood, and I am a real estate practitioner, and I am also the 2023 chair of the New Hampshire Association of Realtors Public Policy Committee. And we support Senate Bill 145. Just a couple facts just to throw out there to give you a point of reference. Our housing inventory today, as of January of 2023, is about 10 times less than it was in the Great Recession. And not that I'm looking forward to going back to 10,000 units on the market, but certainly somewhere between 2007 and 2023 is where we'd like to see it, probably 4,000 to 5,000 units, and we're at 1,200. So there's just needs to be more supply driven into our economy. Closed sales this past month were at a 10-year low, around 600 homes sold in the entire state. And the last time that had happened, I believe, was in 2012. So again, we view this as a supply problem, and clearly it's a complex problem, but this bill, Senate Bill 145, is one piece to pushing forth more supply. The other piece that I'd like to call out, just as far as being a practitioner in the field, if you turn to the first page, line 23, where it talks about voluntary education for planning and zoning board members, we view the planning and zoning board members as stewards of private property rights. And I think any additional training that can take place that heightens their awareness of their importance in that protection of private property rights is an important piece. And we, if you spend some Tuesday or Wednesday evenings in front of a planning and zoning board, you'll know that unfortunately there are those that need more education, and that could lead to untimely litigation and so forth. So those are just two instances from the field that I'd like to give this committee, and happy to answer any questions. Thank you.
Thank you very much.
Thank you, Mr. Chair. I have edited my remarks down, but I will like to glance at my document to share some information. Thanks for considering my testimony to you and members of the committee. For the record, my name is Alan Reitz. I'm a resident of Plainfield, and I also represent the Hanover Co-op Food Stores and Auto Service Centers. We are an $88 million business and 87 years old. In addition to my work on housing, members of the committee might recognize me for ongoing support on matters of transportation and agriculture across the state. We support Senate Bill 145 as being critical. I do wish to address one issue. As someone with regular involvement in state transportation matters, I especially appreciate the consideration of public transportation, sidewalks, and other walkability infrastructure. If the bill's authors are amenable, please consider a call out to safe bicycling needs too. I'm not speaking of recreational facilities, which I appreciate, but rather I speak of the encouragement of resources to help municipalities consider, for instance, how vulnerable populations use a bike as their only means of getting to a job, getting to appointments, and getting to and from their housing, and they have to do that year-round. And with the growing use of e-bikes, we can all agree that roadways made safer for pedestrians and bikers are made safe for drivers too. The language on page 2, line 4 could be amended to read, implementation of public transportation, sidewalks, and walkability and safe bicycling infrastructure. I have that noted in my remarks. In closing, I'm grateful for the continued work of those here who support your efforts on this bill. In the Upper Valley, there's complementary work underway. Last summer, leaders from 8 local businesses and organizations working with Vital Communities and Evernorth, a housing nonprofit, committed $9 million to a revolving loan fund to spur affordable housing not dedicated or targeted at our employees, but eligible residents at large. I share that as a way of saying we are with you. You'll find the names of those businesses at the bottom of my testimony, and you can read more about it in this month's issue of Business NH Magazine. They've got a nice article on the topic. Now I leave you with an offer by asking, what's next and how can we help? Thank you, and I'm happy to answer any questions.
Morning, Mr. Chairman and members of the committee. I'm Nick Taylor, the Executive Director of the Workforce Housing Coalition of the Greater Seacoast. We're a nonprofit serving Stratford and Rockingham counties that seeks to advance diverse housing options attainable to our workforce. I won't, I'll just echo things that have been said before around the need and especially the need from our business community and our workforce. The piece I do want to add here is our organization, we work directly with a lot of communities in the region. They are very excited about this proposal, potentially moving forward. They want to take steps. They want to be part of the solution. Talked with a town planner in Exeter who's wished he could have been here today, but asked that I make his support known. And so I do think this will really work and that folks are excited about this and wanted to make that clear.
Very good. Thank you for your testimony. Seeing no questions, have a great day. Does anyone else wish to speak on 145? Seeing no, go on. Thank you. Oh, it's you.
I'm excited to be in favor of this one, Senator Sharp.
It's a little piece that's missing. We have all this other.
The Honorable Senator Ricciardi is going to introduce SB 202.
Good morning, Mr. Chairman
morning,
and my
Senator.
colleagues on the Senate Commerce Committee. Of course, for the record, Denise Ricciardi, the state senator for District 9, representing 13 towns from Bedford to Winchester. I'm here today to introduce Senate Bill 202 that I like to call the American Dream Initiative. The purpose of this legislation is to help facilitate a key component of the American dream for our citizens of the Granite State. When there's a significant shortage in available housing in the Granite State that we've all been talking about all morning, and especially given the increase in cost of home ownership, this initiative seeks to provide a solution. The intent of this legislation is to fund a pilot program whereby affordable housing can be constructed and individuals and families will have the opportunity to own the homes that they will be living in. We all know that we are in a housing workforce crisis, but we need all types of modalities. This legislation helps to seek a solution for the missing middle. For many families, the home is their single biggest asset, and it is one of the most important ways that they will build wealth over time. Home ownership is a cornerstone of the American dream. Between 2010 and 2020, the rate of home ownership actually declined in New Hampshire from 73% to 71% for people ages 35 to 44. Home ownership dropped from 74% to 68% for those 25 to 34, and then it dropped from 49% to 45%. The absence of sufficient inventory of homes to purchase is having a strong impact on affordability, especially for entry-level buyers. Over the past 3 years, median sale price of homes in New Hampshire has increased almost 50%. SB 202 provides an opportunity to make home ownership attainable and affordable for more of our young families. It establishes a home ownership innovations fund to foster innovations in the development and financing of starter homes. The Home Ownership Innovations Fund will be used by New Hampshire Housing to explore solutions to the development and financing of affordable entry-level homes. This will be done through a series of pilot programs that will focus on construction innovations, such as 3D printing of homes, modular construction, innovations, and energy efficiency, and models of financing to make home ownership more affordable. The Home Ownership Innovations Fund will provide grants and loan opportunities to families and developers. Homes produced using the fund will be affordable to families with incomes up to the median income for the area on which the home is located. I ask you to consider ought to pass. This is a missing modality that could solve a solution and uses innovative products and ideas. Thank you.
Thank you for your testimony, Senator. Seeing no questions, you're all set. Ben Frost.
Good morning.
Morning.
Chairman, thank you, Mr. Chairman, and members of the committee. Thank you for this opportunity to speak. As my colleague Ben mentioned, New Hampshire Housing is an independent organization established by statute, self-supporting, with a mission to create and finance affordable housing and solutions for the people of New Hampshire. Many people know us for our role financing affordable rental housing. Some people know us as the administrator of the Housing Choice Voucher Program for those areas of the state that aren't served by a local housing authority. But we also have an important role working with a network of banks and mortgage companies and credit unions around the state, more than 50 of them, promoting home ownership for low and moderate income home buyers, most of them first-time home buyers. And this work has gotten harder by orders of magnitude over the last couple of years. You've heard reference already to the inventory crisis, which was brewing for some time due to demographic factors and changes in housing preferences. When that was combined with stimulative monetary policy in the form of very low interest rates, it caused a historic run-up in prices and a very overheated housing market. The Federal Reserve's response to that overheated market in the form of abruptly increased interest rates caused an affordability crisis and has priced tens of thousands of New Hampshire families out of home ownership. So that policy response was effective, but these are sort of unfortunate side effects of the use of that blunt instrument. So you've already heard some discussion of the people who have been priced out of home ownership. The other side effect, if you will, that I'd like to draw your attention to is the effect that it's had on home building. And so because families have less ability to buy new homes that are brought to market, this has resulted in a decrease in new home production at the worst time possible. And the National Association of Home Builders has observed a 12% drop in new single-family home starts nationwide in 2022 and projects a 28% drop in 2023. You've already heard about why we need these families and individuals to be able to purchase homes to keep our economy strong and keep our businesses supplied with workers and our communities thriving. What I would say is that, and what we see at New Hampshire Housing is we also need them to move out of their apartments. More and more people are unable to achieve homeownership. That's put increased pressure on the rental market, which has caused increases in rents that are really disproportionately hurting our most vulnerable residents. If Senate Bill 202 becomes law, we would administer the program, and we would work with a range of key stakeholders, including home builders, our traditional nonprofit and for-profit developer partners, and municipalities to ensure that we design a program that's effective, efficient, understandable, and fast. So we appreciate Senator Ricciardi's bringing this idea forward. We appreciate the legislature's attention to the housing issue more generally, and I'm happy to answer any questions.
Thank you for your testimony. Seeing no questions, we're all set.
Thank you.
Alyssa Margolin.
Mr. Chairman, members of the committee, for the record, my name is Alyssa Margolin. I serve as Director of Housing Action New Hampshire. We're a statewide affordable housing coalition working to improve state and federal policies so everyone in New Hampshire has a place to call home. And we view Senator Ricciardi's proposal in SB 202 as aligned with our mission. Our members are those who develop, finance, and manage affordable housing. And I'm pleased to share with the committee that there is a growing interest in getting into the affordable homeownership business and getting into the starter home business, and really serving those who are ready to transition from a rental home to homeownership and partner with a trusted agency like New Hampshire Housing Finance Authority to do so. And so we are in full support of this proposal and looking forward to partnering if such a fund should be included in the final budget. Thank you. I'm happy to take any questions.
Thank you for your testimony. Seeing no questions, thank you. Harrison Kneller.
Thank you, Mr. Chair and committee members. My name is Harrison Kanzler. I'm the Executive Director for AHEAD in Littleton, New Hampshire. We are a nonprofit affordable housing developer, manager, educator. I want to thank the Senator for bringing this bill forward. This is absolutely a critical need, again, for the rural space. As far as affordable housing is concerned, we manage over 500 units of affordable rental housing, and we have a situation where we do have tenants who have gotten better jobs, increased their income, and are actually overqualified for the affordable housing that they're living in. Unfortunately, there's no market rate rentals for them to move into, and that's because all of the market rate rentals are filled with people who have no homes that they can move into, because all of the homes that are being developed are very large and expensive. Unfortunately, to your point, Senator, there's no starter homes really being built anymore. We are actively engaged and looking at how we can do this. This program would be a huge step forward for developers such as myself to be able to make this a reality. One of the municipalities I referenced in my earlier testimony is actually specifically asking us if we can develop an affordable neighborhood for workforce to move into. A new part of town that would have families come and live there and participate in the community. This bill would allow those types of things to happen. We support this 100%. Thank you very much for your time.
Thank you for your testimony. Seeing no questions. Maggie and John, it's Valentine's Day. Want to come up together? To be judicially economic with our time. How much are the little homes?
How much are they?
Yeah.
Well, they're not for sale. They'll be rentals.
Oh, they're going to be rentals. Okay. Great.
And that will be the fair market rate as, released by New Hampshire Housing.
Can you get, yeah, thank you for getting the other chair.
This is our Valentine's Day date.
That's why I brought you up together.
Perfect. Thank you.
Go ahead. Thank you.
All right, so bear with us while we repeat a little bit of information.
Just tell us who you are.
Yeah, my name is Maggie Randolph, and I'm an architect and owner of GSD Studios out of Exeter, New Hampshire. John and I own Harmony Homes Assisted Living in Durham. We are in the process, as I said before, of building 44 freestanding cottages for rent and built 7 apartments last year in support of our staff. We got into building affordable housing because we heard over and over how difficult it is to find affordable places to live, even when being paid competitively. And our rental units have helped us to stabilize our business even in this unsteady climate. However, we know that these rentals are only meant as a stepping stone for what would truly provide stability for everyone, home ownership. Being able to own a home is a key part of the American dream, not only allowing a family to build equity and provide for their future, but also to put down roots. As you're well aware, New Hampshire has the second oldest population in the country. We need to create more opportunities for families to settle here, or our state is going to decline. We have an incredible number of jobs across the spectrum with opportunities abound. We have fantastic schools, something that our kids have taken advantage of and are currently taking advantage of in an amazing environment. We have everything we need to offer families, but we need more housing, not only for those who live here already, but for those that we need to attract in order to maintain and grow the vitality of our state. With the cost of homes continually growing, opportunities to provide creative housing such as 3D printed homes and funding opportunities to allow families easier paths to ownership are absolutely essential to New Hampshire.
Thank you, Mr. Chairman, Senators. Good morning. I'm John Randolph of Exeter, New Hampshire, and owner of Harmony Homes Assisted Living and GSD Construction in Durham. Our company will have added 51 affordable units in Dover and Durham by the end of 2023. But with the current housing crisis in New Hampshire, it is time to truly get creative and find new ways to address the housing shortage. High material costs and labor costs continue to be a barrier to building affordable housing. Senate Bill 202 encourages innovation in a way we can look at building in new ways and try new ways to facilitate home ownership. We need home ownership to be an attainable goal in New Hampshire in order to retain individuals and families, but also to attract new individuals and families to New Hampshire. A strong New Hampshire economy is based in a motivated workforce. A motivated workforce is housed in high-quality, affordable housing. Please support Housing Champion Bill 202. Thank you very much.
Thank you for your testimony. Any questions? Oh, what does it cost to rent?
Well, last year, again, the fair market housing rate as released by New Hampshire Housing. So for our HUD region last year, that was $1,092. They release the updates every April, but that is what we agreed with the city will be the maximum rent charge for each of these units.
How many square feet were they?
Well, they are
Approximately your average.
they're 384 square foot footprint, so they're 16 by 24, and they have 160 square foot loft that you can, even John here at 6'2" can easily stand up in. So you get about 540 square feet in total.
Very good. Thank you.
Thank you.
Chris Norwood.
Mr. Chair, members of the committee, for the record, again, my name is Chris Norwood. I'm a real estate practitioner in the state of New Hampshire and also the 2023 chair of the New Hampshire Association of Realtors Public Policy Committee, here to speak in favor of SB 202. Also, for the record, I would like to disclose that I am on the board of the New Hampshire Housing Finance Authority, the organization that will be administering these funds, and I think that it's important to disclose. Without repeating any of the testimony here, what I'd just like to say, years ago, for about a decade, I was on the board of Manchester Community College, and I had the opportunity to watch as these students in their 20s built a house, stick built inside the shop, and then we eventually sold off the house as part of the program. But you got to watch these kids learn and how to build a home. It's, stick built from the ground up. And what's drawn to me is line 19 here with the consideration of ranges of alternatives. And the students that I witnessed, probably about 15 years ago now, build that house, and how there are aspects of that construction that are completely outdated. And there's construction that they're learning in the field, and we need to administer that education down the chain, and we need to encourage that innovation. And by no means does this bill mandate anything going to Manchester Community College for innovation, but what I am encouraged about is that concept of ever moving forward and having witnessed on the ground floor students, New Hampshire citizens, learning the trade and having this as being an opportunity to further that innovation, I think is really cool. So thank you, Senator, for bringing the bill forward, and I will entertain any questions.
Seeing none, thank you.
Thank you, Mr. Chair.
Nick Taylor, one more time.
We've got a lot of the same crew stuck around here. So thank you, Mr. Chairman and members of the committee. I'm Nick Taylor, the Executive Director of the Seacoast Workforce Housing Coalition. We're a nonprofit that advances diverse housing options for our workforce in Stratford and Rockingham County. We're here in support of Senate Bill 202, and I also would like to thank the Senator for bringing this forward. So often when we're talking about workforce and affordable housing options, we're talking about rental units, and homeownership opportunities need to be part of that conversation. For us, when we're thinking about how we reach that balanced market, you really do need ample rental opportunities, starter homes, homes where folks are raising their family, and then places for folks to downsize, because that really contributes to the full balanced market and has the healthy turnover. I do believe, we're missing a lot of different home opportunities here in New Hampshire, but home ownership, those starter homes, those downsizing homes are absolutely a piece of that puzzle. And, thank you for bringing this forward, and hope the committee supports this bill.
Your testimonies. No questions? Darren, Priscilla? Darren, Messenger, Economic Development?
I know somebody else lined up. I didn't know if that second sheet made it up there. Okay. So my name is Darren Winham. I'm the Economic Development Director for the town of Exeter, and I want to talk about ways this bill would work practically. There is, as an example, a 3D printing company in Rochester, and they are seeking to print affordable homes. They're working with UNH Advanced Manufacturing Center as we speak to create a new nozzle system for their robot that makes their print less viscous, less byproduct, much more affordable. That's what they're trying to do. This money, these resources could go to something like that. Likewise, there is a developer in Exeter who owns both commercial, and he is building apartments, unfortunately, but this could go to that in the future, where he wants to put solar on his commercial building and use that power to power his 56 affordable units out of 224 unit building. The other thing I want to say is Maine is doing this right now. Maine is 3D printing with wood flour. I don't know if you folks have seen that, but they have, they're putting a contract together to build a bunch of affordable housing. So there's no reason we can't do it if they're doing it. And the last thing I want to say is that I think this legislation would dovetail very well with some of the other legislation that is going through the system right now, such as Senator Ennis's bill. I think this would be good money after good. So thank you much.
Any questions? Can I ask you one thing? Just tell me, because and I'm curious, and I got you here.
Yeah.
How does this stuff hold up? And tell me, is it you said it was a wood flour mix? How does it hold up?
I haven't seen it. I've only seen the concrete. The one in Rochester is doing concrete.
Okay.
And they think that'll be even more affordable than the wood flour in Maine. So,
Okay. I've seen plastic ones in Philadelphia.
Yeah, that's the way to go.
I like the concept. They're not very nice inside, but thank you.
Thank you.
Does anyone else wish to testify in this bill? Seeing none, thank you. Oh, I'm sorry. I'm undoing that. That was a mistake. I apologize. You weren't on my list.
Thank you. Good morning. My name is Adam Carter, and I am an entrepreneur and investor in mostly in the commercial real estate space and the real estate space in general. Thank you for the opportunity to speak. One of the things that struck me about this bill, which I think is relevant here and has been covered already, is that there really is kind of an exponential benefit to the investment versus a dollar for dollar investment directly into housing. This finances technologies that will allow it to have a greater impact that hopefully will ring out to various different projects over a period of time, and hopefully help the problem significantly. That's it.
That's good.
Keep it
Short,
simple.
brief, to the point. Love it. Thank you. Does anyone else wish to testify? Seeing none. We're going to take a 10-minute recess, and then we're going to accept some bills. executive session for commerce is now convened. We're going to start off with one we heard today, SB 202 FN.
So moved.
Second. All in favor?
Aye.
Opposed? It's unanimous, 5-0. Motion for consent?
Wait, no.
Into Thank you.
For everything all at once.
Yeah, we'll do every bill right now.
Can I go?
Take 30 seconds. Yes, go ahead.
Thank you. I make a motion on SB 202 FN ought to pass.
Second.
Discussion? All in favor?
Aye.
Opposed?
Move
Motion-
consent.
Second.
Vote
All in favor?
aye.
Opposed? Ayes have it.
Okay.
Beautiful. And you want to take this out, Senator,
Yes,
correct?
please.
There you go. Okay. We're going to move to SB 33, an act relative to the fee differential for non-member lot rent in a manufactured housing park. Do I have a motion? Ideal.
I move inexpedient to legislate.
Second.
Discussion?
I would just say that I did think the amount was too much. I thought we could come to a more reasonable number, but,
What would that be?
well, I just think leaving the 25 is a hard number that you're going to have to revisit over time. I thought if we could hit a percentage. I thought the percentage proposed was too high.
Okay.
Putting a percentage in might,
I'm wondering, should we maybe think about this one another week and see
Yeah,
if we
we're
can
open
develop
to your
an amendment?
percentage. I should talk to you
Or
first.
could I just make a
Yes,
comment?
go ahead, Senator.
Okay, as to, just a few comments to think about of why the bill is not needed. The non-member lot rent fee was capped at $25 a month when it was in SB 210, and it was passed by the Senate Commerce last year. This was done because the committee discovered that there were resident-owned communities charging $200 plus a month for the additional non-member lot rent fees. Then there was testimony provided that some boards use the threat of revoking a resident's membership for a cooperative to keep residents in line rather than enforcing their rules on violations. And we also heard testimony that there are resident-owned communities that pay almost $600 a month in a lot rent, which is adding 15% non-member lot rent fee, which would result in a resident almost paying $700 a month. And this would be on top of their mortgage and their utility bills. So I feel that the bill is simply unaffordable for these residents who may be on fixed incomes, especially at a time when we're already faced with high food prices and energy. And so that's my thoughts.
I probably echo the senator, but I'm willing to listen to the percentage so we can talk about it another week. So we can, if someone would withdraw the motion.
Yep. I withdraw the ITF.
The second.
Thank you. Thank you. We'll revisit this in a week. Talk about it in between. We're going to go to SB 46, an act relative to electronic payments to employee debit cards. Senator Susie, where you at? How are you doing with this? Before we say anything?
in its present form, I would oppose it. As I said, I have two concerns. Certainly the primary concern is that if there is a small percentage of people that want to get a paycheck, I don't understand why, for the handful of people we're talking about, this is a burden. But the second part is that this takes away the language that requires that the employer provide terms and conditions of the payroll account option. And that, I don't have an amendment unless there has been one handed out that replaces that. I think that's a problem.
Senators, your thoughts?
You know, I did reach out to the banking department and got some information from them on whether or not check cashing agencies could use these cards and that sort of thing. I knew that was one of Senator Susie's concerns. The findings are that generally they can if they so desire. But there were some issues that the folks noted. One is that there are occasionally fees that go with the cards. It depends on which type of pay card program is used. There can be issues or delays with getting payment. It doesn't seem to be a major issue, and the department hasn't received a large number of complaints, but they have received some. There are issues, and this one's pretty legitimate, relative to withdrawals from ATMs. If you get paid $103, you can't get that out because the money comes out in increments of 10. So not a big deal, but it's still, something to think about. And then some issues after somebody leaves the company. None of these were major or insurmountable, but they are somewhat legitimate.
Mr. Speak.
I think.
Okay. Do you wish to make a motion, Senator Ennis?
I'm going to make a motion about that.
Second. Do you want to discuss further, or
I think
Okay.
Senator Ennis clearly outlined the reasons why we shouldn't be voting for it. Once again, we're discriminating against a small, discrete group of people who currently have the power over their own destiny to determine whether they want to use a bank or not, whether they want to accept a card or not, and we're taking that away from them. So
And
for
I-
those reasons, I
would say I appreciate the senator's comments, and I share those to some extent. But the response from the banking department put some of my fears at ease. These are relatively uncommon issues that can be addressed, and that's what brings me to the about to pass.
Thank you. Further discussion? Senator Shanley?
no, thank you.
No. Senator Shardy? Okay. All in favor?
Aye.
Aye. Did you say anything?
Okay.
Okay. Opposed?
No.
Opposed?
Okay. Very good. 2 to 3. Yep. You want to take it out, Senator? You're in the minority. It would be your bill to
Well,
take
we
it out.
would have to make a motion, since the motion was
Yeah.
defeated, we'd have to make an
Oh, okay.
alternative motion. I would
Go
move
with your-
ITL. Second.
All in favor?
Aye.
Opposed?
Opposed?
Nay.
Okay.
Now, Senator Susie. Sounds good. Where are we as far as, you were getting some information on the refrigerators? Okay. Thank you.
Move ought to pass on the bill.
Second.
All in favor?
Well, not yet.
We haven't
Oh, yeah, we
amended, so
haven't
we
seen
have
the
to do the
amendment. Sure,
amendment.
yes.
I have a copy.
Thank you.
I think so. Oh, no, I've got it. Thank you.
That's okay. If I could, Mr. Chair,
Yes,
I'll
go
move on
ahead.
to pass on the amendment as well.
I'll second.
I think what the amendment does is replace the middle section and it corrects on line 6, a statutory reference. So where it says 42 USC section 7675, that should be 42 USC section 7671K. I
Okay,
think that's all we're doing.
sounds good. Voting on the amendment, all in favor?
Aye.
Aye.
Opposed? All in favor? Motion on the underlying bill?
I'll move on to pass.
Second, whoever.
We already had that.
So we had it, so we're all
We
set.
need the vote.
Okay. On the bill, the vote, go ahead, all in favor?
Aye.
Aye.
Move consent.
Second.
Who wants to take it out?
Oh, we-
Well, we'll vote on it. Yes, I'm sorry. All in favor?
Aye.
Any particular person want to take it out?
I'm not touching this one.
Senator Shanley, you can do it?
Sure.
Sure, okay. Thank you. SB 97, relative to the use of animal product testing. Discussion?
I'd like to make a motion and speak to my motion, Mr. Chair.
Go ahead.
I'd like to make the motion of re-refer, and I want to explain why.
Second. Go ahead.
So I do not want to see testing on animals and personally go out of my way to buy things that are not. But after I listened to the testimony from the department and the AG of trying to find a person who can enforce this and create a whole new department with a fiscal note, it made me want to look and research this further. So I said to myself, how many companies are testing on animals in New Hampshire? And what I found was there are 15 companies in the United States that are testing on animals, but none of them are in New Hampshire. So then I looked at the products that are on our shelves from these companies, and they're very vast. I mean, there's Listerine, Aveeno, Degree deodorant, and there's so many things. And then I looked at the history in our legislature where this bill keeps coming up and it passes maybe committee, but then it dies down the road. So my thought at re-referring is to not kick the can, keep getting it to pass committee and then die down the road, but let's really actually find a solution to this problem. And therefore, re-referring will give the sponsors the appropriate time to get to the bottom of these unanswered questions and figure out a proper solution. Thank you.
Anyone else wish to speak?
That's fine.
Okay. You did all the research, so I'll just let your speaking go. Okay, how do we move next?
We have a motion and a second. on
Okay.
re-refer.
All in favor?
Aye.
Aye.
Opposed? Okay. Okay, motion for consent, second. All in favor, consent?
Aye.
Aye.
Ayes have it. Do you want to take it out? You did all the research, sure. Sounds good. Can we talk about 137 first? So we heard all the nano breweries, we heard both sides of the issue. Manufacturers have problems with it. We've worked on this year after year. Do we think, and it seemed like that they didn't get together this summer enough and work it out. They seem both amenable. We've done this a long time. I did the bill last 2 years ago, 125, I think it was.
What do you say we give them another shot?
So I think we give them another shot to get together this summer. Should they not be able to come together, then we'll get involved.
I move re-refer.
Second. Okay. Is that okay? Do you guys, just wonder your opinions. I like to talk.
No, I'm
Okay.
okay with, I don't think the bill in its current form should pass.
Yep.
There are definitely problems with it, so.
Agree.
Okay. So we're voting on the re-refer motion. All in favor?
Aye.
Aye.
Opposed? Re-refer
Consent.
has it. Consent? Okay. I'll take it out.
All,
Vote.
Oh, I'm sorry.
Consent.
Consent?
all in favor?
Aye.
Aye.
That's pretty good. Ayes have it. I'll take it out. Thank you.
All right.
Okay. We're going to go to 143, an act establishing a scholarship fund for certain businesses applying for cities. Put the glasses down. Applying for loans from the Capital Access Program administered by the New Hampshire Business Finance Authority. I am going to motion an ITL. Dan?
I'll second that.
Discussion. I don't like favoring any group over another. I want equality. I want people to move up because of their abilities. I don't want, if I have 3 children, one who's gay, one who's a woman, one who's a straight male, I don't want the other, my best one could be the guy who can't get the loan because we're going to give it to one of the other 2. I want everyone applying equally. I think we bring everyone down, and I want the best and according to your abilities. And so that is why I don't like 143, and I motion to ITL it as we've already done. Do you have any thoughts, Dan?
Nothing further. I think you captured.
Okay. Do you wish to speak, Senator? Go ahead. Senator Susie.
I actually disagree with the logic because I do think we know that certain groups are historically discriminated against. And what this is trying to do is to actually level the playing field as opposed to put it out of whack. So I think this bill is an opportunity to allow certain disadvantaged people to get fair treatment and to start small businesses. So I would oppose the ITL.
Okay.
I am in agreement with Senator Susie. Absolutely, there are people who are economically disadvantaged, and if there is a program to help people get access to capital, I certainly would want to support helping that capital get to those who are economically disadvantaged.
So one of my problems, it went beyond economically disadvantaged. It it also dealt with social. So I have problems when we're looking at race, sex, and these other factors. I just want everyone equal. So I could maybe have lived with it if we didn't have that part of the bill. I remember the wording in there. So that's where I was problematic with it.
I tend to agree. If it's targeting the economically disadvantaged, that's one thing. And I think there's some merit to that.
Anyway, so voting on the ITL, all in favor? Aye.
Opposed?
3-2.
No.
I will take it out.
Right.
Okay, now we'll get to the easy ones. SB 144, minimum wage, there's a little humor there.
Well, I move on to pass.
Okay.
I'll move inexpedient to legislate.
Well,
You have to deal with
yeah, we have to deal with that first. Go ahead, Senator Susie.
So I think you all have the handout that I provided, and I think it puts New Hampshire at a horrible disadvantage when you look at the fact that every neighboring state in New England, we could go farther than that, but I think it's more important to stay within. Every single state is at $13. Now, I understand there might be people around the table who think 13 and 15 are too much. If you would propose an alternative, I would certainly entertain it. But leaving our minimum wage at $7.25 in this day and age, businesses can't find people to take jobs for $15 an hour. I just think it's a black eye on our state, and I think morally it's just horrible to continue to maintain that wage. As I said, I understand 15 may in some people's eyes be too high, but I would hope if you're opposed to that you could propose an alternative, because $7.25 just isn't the right thing for our.
Senator Ricciardi.
While I see Senator Susie's point, I took this to heart and I started really researching other states and how the impact when they raised the minimum wage affected them. And I found that it actually increased unemployment, and it also was hurting first-time people to get a job, because if the business has to pay someone $15 that is not experienced, then they're going to go and they're going to pay the person who is more experienced. So like young children who want to get that first job. It also makes more automated and reduces the ability for people. So I see both sides of it. But at this point in time, when people are paying so much, I saw a sign for Orange Julius at the mall for $19 an hour. I feel like now is not the right time, given what I saw across the state for those who did raise the minimum wage.
Senator Gannon.
Senator Ennis, go ahead.
I appreciate your feelings, Senator. Some numbers to go with those feelings. I checked into this as well, and I found some rather interesting things that quite frankly surprised me. For example, all of the states around us, as Senator Susie noted, do have much higher minimum wage rates. One would logically conclude that if that is the case, they would be paying higher hourly wages to the workers in those states. That is not the case. Only the state of Massachusetts has an average hourly wage rate that is higher than New Hampshire's, and not by a lot. And New Hampshire's average hourly wage rate is over $22 an hour, far above even the minimum suggested in this bill. Furthermore, the average starting hourly wage rate in our state is $14.86, just 14 cents below where this bill would be after a short time. And I'm concerned what will happen to some of those lower wage jobs that are for seasonal high school employees. It helps teach them a work ethic. It gets them going to work every day and developing a pattern. And it gives them some financial freedom that I'm sure they enjoy. So I understand the desire to raise the minimum wage, but the facts on the ground in New England suggest that it doesn't really have an impact on actual wages.
I'll just add one thing to what you both just said. Sandown, we have two real businesses, a pizza place an ice cream and a coffee place. I sit down with the owners, and their one thing is always do not raise. If you raise the minimum, we're going to have to raise our costs. We're in both places, the average worker in there is making 15 an hour, be they 14-year-old kid or older with their tips. And the pizza place, some of them aren't getting tips, but they're all making 15, 16 an hour. The owners say that it's just going to go on top of my $14, $15 pizza is going to be $20, and they said it's going to put them out of business. So listening to the businesses in my community, I have to say no. Thank you. I think we've all spoke. We're ready to vote?
Several more points, but I'll save them.
Oh, okay, same for the floor. Me too. Motion on the ought to pass, all in favor?
ITL.
Thank you.
No, first we gotta let them vote.
Aye.
Yeah. And so you two are,
Yes.
and 3 against, so new motion.
On to pass?
Second. All in favor?
Aye.
Aye. Oh,
Great.
but no.
You moved on to that. Thank you, Senator.
No, no.
I appreciate that, and you voted for it.
I didn't vote. I didn't vote.
I made a mistake.
So ought to pass.
I did not understand what we're voting on. I'm sorry. It's my fault.
I didn't vote. I didn't say
With
anything.
permission, could I withdraw that motion?
Yes.
I think you have to move to reconsider the vote.
Move to
Yeah, I think
reconsider.
that's right.
Thank you, Senator Susie.
It's been a long
Motion to reconsider. All in favor?
What's the motion on the floor?
To reconsider the
Oh,
vote.
yes, in favor. Aye.
Thank you. So we're 3-2.
Okay.
Go ahead, Senator Ennis. Do you have, so we
Yes, I
defeated
move.
your motion.
Inexpedient to legislate.
Second.
All in favor for an expedient? Aye.
Aye.
3-2.
No.
Senators, which one of you
I'll
want to
take
take it? Senator Ennis will take it out. Thank you.
Thank you, Senators. My mistake.
I was close.
You
You
were
were
really
close. That was as close as you've been in 10 years.
Actually not true. We actually passed it in
Oh,
2019.
okay.
Governor vetoed.
We're not going to do 145 that we just heard. Which one was? We're going to do 193. Do I have a motion on 193?
I'll move on to
Actually,
pass.
could we wait on that?
Oh, sure, we can wait on that. I thought we had it for you. Wrapped up. I thought after the other one.
No,
Give you a
I'm
gift.
sorry, I wasn't.
Okay,
No,
we're gonna wait.
I'm not a co-sponsor on this.
Oh, okay. So yeah, 194, the students to taste.
Mr. Chair, I wonder how the senators feel about this bill.
Okay, we'll
I'm
talk first.
supportive.
No, don't I need a motion first, Senator? Or can we
You're
discuss
in-
first?
you're
Sure,
in
we're going to
executive
discuss
session.
first. Thank you, Senator Ennis. I think Senator Ricciardi and I think it's a bad look for the state. It's against federal law. So we tend to, while we appreciate your position and that you believe it'll help economic development, we think it needs to be at least worked on and re-referred. So we could live with the motion to
It
re-refer.
helps education, and that's the main purpose behind it. And as I stated before, I understand there are concerns with tasting and spitting. I get it. At the same time, we have these young people standing behind bars until 2 a.m. serving mixed drinks to customers. They're probably sipping now and then while they're working. They might be taking some home. Who knows? My point is, this is a controlled educational environment with 2 instructors in the room, and it's a safe setting to understand and appreciate the products that you're representing for a restaurant owner on the floor or as a part of your future career as a restaurant owner, hospitality professional, whatever the case may be. And that's its sole intent.
Thank you, Senator. You've heard from our side of the table. We haven't heard from you two.
Go ahead. I would not support this bill.
Okay. Senator Susie?
Yeah, and I still have a concern that I don't think we've addressed, which is the federal highway funds.
Yep.
If we had even one segment of the population that could drink at 18,
Yep, that's a lot of money.
what I looked at,
I would counter that 17 states have already started doing this and no one's gotten in trouble, but I appreciate that.
So Senators,
So could I make a motion to re-refer?
can we talk first?
Yeah, sure.
Okay, so 2 of us could re-refer ITL, you two. So we were wondering where you stood on an ITL versus giving the senator a little more time to maybe make it more palatable to all of us.
I can support that.
Okay,
Thank you.
so I move to re-refer.
I'll second that.
Okay, all in favor?
Aye.
I
Opposed? Okay,
Move consent?
so,
Second.
okay, all in favor of consent?
Aye.
Opposed? Consent has it. Senator Ennis, you want to take it up?
Yes, of course.
Okay, we're moving on to steel, 195. Discussion, or first we'll have a to pass motion I'm making.
All right, I'll second that.
Okay, any discussion? Again, Senate Bill 195, it was on buying American steel.
Is there an amendment?
I hadn't seen one. Is there? Okay, not that we're aware of.
Could I ask that
Sure,
we hold on this? I
Sure.
apologize for
that's
not
okay.
doing that sooner.
I withdraw my motion.
I agree, because I do have an amendment,
Okay.
proposed language.
Okay.
Not in official form.
Right.
I think Senator Carson handed it out, so.
this.
Yep, exactly. Yeah. So
Okay.
let's check back with her. to
So I'm
make sure.
withdrawing my motion.
Thank you.
Okay.
Do I need a second on withdrawing and then vote? No. Okay,
No.
great. Thank you.
Great.
Let's see. Senator Shanley, you wanted to put off 201, which we'll
Yes,
do.
I have a meeting coming up
Yep.
this week.
What about 198?
And
Can I make a
Yes.
comment about 201 so that maybe Senator Shanley, when you have your meeting, you could address?
go ahead.
So, one of the things that I thought may help with this problem is that the bill doesn't address is there a law or do we need a law to not allow replicating these sites, which seems to be the bigger problem, is people think they have the authentic site.
And I'll certainly raise that issue. Thank you,
Thank you.
Senator.
Go ahead, Senator. I'm sorry.
No, I was
Okay.
nodding my head in agreement. I think the issue is, I think there's two issues. One is the price inflation, but I think the issue of somebody buying and thinking a valid
Yes.
ticket and then going to the box office and finding out they don't have a ticket at all is really.
That's the real problem.
It's got to stop.
Yeah.
Okay, Senator Ennis, did you want to go to 198 that we heard today?
Go to 198.
Sure, do you have a
and
motion?
I'll offer an ought to pass, or an ought to pass on.
I'll second. Any discussion? No discussion? All in favor?
I
No opposed? Second. Motion for consent, all in favor?
Aye.
Opposed? Consent it is. Does anyone want to take this up?
I will.
Okay, very good. And I think that's all I wanted to take out today. Do you guys have something else you want to address? Seeing no, everyone, oh geez, we get a 10-minute lunch.
May I ask
Thank
a
you.
question?
Oh, I'm sorry.
I'm sorry. And perhaps it's really a parliamentary question, and I just want to make sure that I understand. When we're in executive session, we do not need a motion to discuss the bills. Is that correct?
Correct.
Okay. A motion on the bill. Okay, thank
Okay.
you.
Okay, seeing that we have no more business,
Motion to adjourn.
Second.
all in favor?
Aye.
Adjourned. Oh, I'm sorry. Well, you can-
It's saying that.
Maybe it's supposed to happen. I don't know.
That's all right.
But thank you.
We had to read